to Ellevate Louisiana Engage podcast. Ellevate Louisiana was founded earlier this year to empower women leaders throughout Louisiana by connecting and educating them on the challenges impacting our state with data-driven, nonpartisan solutions to make a better future for Louisiana. Hello, I'm your host, Julie Stokes. Today, we are recording the third episode in a series on the state of healthcare in Louisiana. Our guest today is Courtney Phillips, who serves as the Secretary of the Louisiana Department of Health, the state's largest agency with a budget of $14 billion. Her oversight responsibilities include public health and other direct service programs for citizens, such as behavioral health, developmental disabilities, aging and adult services, emergency preparedness, and the Medicaid program. Dr. Phillips previously served as Executive Commissioner of Texas Health and Human Services, where she was committed to improving the health, safety, and well-being for millions of Texans. Before joining Texas Health and Human Services, Dr. Phillips served for 3 years as the Chief Executive Officer of the Nebraska Department of Health and Human Services, and spent 12 years with the Louisiana Department of Health in a variety of roles, giving her keen insight to all aspects of health and human service operations. Dr. Phillips earned a bachelor's degree in kinesiology, a master's in public administration from LSU, and a PhD in public policy from Southern University in Baton Rouge. She continued honing her skills of process improvement by earning an executive green belt in Lean Six Sigma. The Secretary provides leadership and technical support services while maximizing resources in order to fulfill the mission of the Louisiana Department of Health. We most recently hosted the two immediate past secretaries of the Department of Health, Rebecca Gee and Kathy Kleber, as well as your own Assistant Secretary in charge of behavioral health, Karen Stubbs. And we're very excited to talk to you today. Welcome, Dr. Phillips.
Well, thank you for having me. I do appreciate the opportunity to be here. And I do appreciate the opportunity to be a part of the conversation with the organization that really focuses on empowering women across our state. So congratulations on getting this organization started.
Awesome. We're excited about it too. We appreciate that. I just wanted to open up with COVID-19. I mean, this thing is it just keeps going and going and going. And, we've gone through all kinds of stages with it and up and down, and it's just been crazy. And you started about a month into it. And what's it like walking into a state health department in the middle of a public health emergency?
Well, sometimes you pick the best timing for things. So I guess for me, this was optimal timing. Coming in from Texas, and no matter where I was going to be in the midst of this. But it's no place like home, and doing something like this and serving the people of your own state. But I had the opportunity to walk into a great team, so that's always extremely helpful, particularly for a challenging situation. This is something that we have not faced in our generation. I mean, this is not something that we've seen since 1918. And so here in Louisiana, we are accustomed to emergency preparedness events, particularly hurricanes. This is an ongoing hurricane and something that we have not seen, and it's just unprecedented. And so understanding the ongoing changes with COVID-19, it's a challenge within itself. But unfortunately, we have been able to tackle it. We have made success in our state. And I think you can see that by our numbers.
Yeah, I agree. How did the department respond to some of the early challenges in the pandemic?
Well, I think, one of the things that was really nice, it was all hands on deck, of course, for the department, but the other state agencies as well. But I think what COVID has shown us, particularly for the healthcare sector, is that it's not just state government that plays a part in it. State government itself cannot just be successful in improving the health of our state, and all states. And so really partnering with other entities, our normal stakeholders in the health department, the hospital organizations, nursing homes, academia stepped up and came to the table to work with us. And it really has been a complete partnership across the board. We couldn't have done some of those early things without those partnerships. We had ULL stepping up to help build dashboards. We had, Oshna working with us to run data, Blue Cross Blue Shield, some of our other hospital partners, our hospital, association running information in terms of availability of beds. And so, we built off of the foundation that we had and we used for other emergency events, and it was able to capitalize on some of those structures that we already had in place. But it really was everyone rolling up your sleeves and getting it done and just bringing to the table what you could to help our state.
Yeah, I can only imagine how trying that is. One of the early findings with COVID-19 was just that African American residents were experiencing such, horrible symptoms and severe outcomes at a much higher rate than anybody else. What should we take from that finding? And does that compare to what's being seen all around the state? I mean, all around the country? And how has it evolved over time?
No, absolutely. Thank you for bringing that up. That is something that we saw, across our nation, and we saw it here in Louisiana as well. When you looked at early on the data, it showed that about 70% of COVID deaths were among African American, even though they only represented about 35% of the population here in Louisiana. Early on, the governor enacted the Louisiana Health Equity Task Force that brought together health partners, business leaders, academia to really hone in and put some intentional effort and focus around this. I am pleased to say that today, those deaths and that rate has gone from 70% to about 45%, a little under 45%. And so really some intentional effort that went into that and working with that task force. I mean, those included things looking at testing, where was testing occurring and how do you bring it directly to the impacted communities? Another thing that we learned and we've evolved over time is our data, the availability of data, real-time data, and data that people can use to drive their personal decisions. And so understanding, when people understood who was mostly impacted in terms of that death rate, we were able to share that information, push it out to community partners, and they were able to push it out to the community. Another thing, that we learned with the Health Equity Task Force in terms of who's sharing that message. And so messaging and communication has been a key role in terms of our COVID response, but making sure you have the right individuals communicating in those communities, making sure it's getting to individuals. And so again, working with academic partners, legislative members, local leaders, the health equity experts, and really developing a plan of action to address COVID, but also how do we use this momentum for COVID going forward in terms of health equity? Health equity isn't something, and health disparity didn't just pop up with COVID. These are long-standing issues that COVID really has put a spotlight on. And so the work of the Health Equity Task Force, that is something that we intend to continue and to really build upon their recommendations that they put forward. I mean, they looked at multitudes of things in terms of the COVID testing sites, looking at PPE availability, looking at business operations, looking at the availability of data on the dashboard. And so really helped us to hone in terms of how do we put some intentional effort around this.
Well, I love the dashboard. I mean, it's very helpful. For a long time, when COVID first started, I kept track of all the numbers in a spreadsheet, because I was just waiting to see what was going to happen. And I have that dashboard bookmarked on my phone, just kind of keep an eye on it.
And we've made, over time, and that's the thing, with COVID, as you learn more, you're able to produce more. But we were one of the first states, I think one of two states, to do a public dashboard. And it was really important for our state to be able to publicly share that information. And of course, it's a double-edged sword because you are trying to do the quality checks very quickly to be able to provide that information. And so as we post them, we're still doing quality checks on the data. But I think it's very important for our residents to see what's happening in real time as much as possible, what we're using to make decisions on, how the data is driving those decisions. And over time, we've been able to flush out the dashboard more and more in terms of demographic data, to produce it by regions, including education data, building it out by parish level information, the percent positivity by parish. And so really ongoing have made a lot of improvements and advancements to that dashboard.
It really is good. I mean, one of the first signs of COVID that we had, like here in the New Orleans area where I am, was nursing homes, when it hit, what was it, Lambeth House. And, here and everywhere, nursing homes were just hit particularly hard. Why did we see so much of that in nursing homes? And, how did the department respond to try to bring that down?
No, and you're right. Nursing home residents, we're highly impacted population. One, because of the setting, it's a congregate setting, but also they're among our highest risk population when it comes to COVID and to some other underlying conditions. The age, they're more medically fragile, and that puts them at a higher risk. And so working with our CDC partners and CMS partners, really some of the first interactions after that congregate setting popped up with COVID really was they implemented some of the visitation restrictions. And that was really hard for residents, for nursing home residents, for family members, for those caregivers in the facility. But really understanding how the virus was entering into that facility. And again, because we know that such a large percentage of individuals with the virus are asymptomatic, many people who were coming into the facility didn't know that they had the virus and were carriers and were spreading it. And so some immediate attention in terms of that limited visitation. Happily, we were able to lift those restrictions, working with our federal partners in terms of visitation and encouraging, more outdoor visitation. We've seen some of our numbers improve in terms of nursing homes. Very early on, we had, some of the highest cases of COVID deaths in nursing homes among all states. Right now, we rank 5th in terms of nursing home deaths per 1,000. But we continue to make improvements in working with our nursing home association and those team members who are on the ground continuing to serve on a day-to-day basis. So we really do appreciate their effort because they partnered with us and really came to the table.
Okay, so it begs to me to ask though, why as a state, why are we 5th? Is it 5th to best or 5th from the most dangerous?
No, the highest. I mean, early on we're in 5th. It's still high, still extremely high. When you start to look at the number of nursing home residents, the number of individuals we have in nursing facilities, and really understanding what's happening in those facilities. And so we send in, anytime a nursing home, we see an increase in cases, we'll do infection control response where our public health team, not on the survey licensing side, but on the public health side, our teams will go in, do a review of the current practices, help the nursing home to understand in terms of, do they have a problem with PPE mitigation? Is it access? Is it how they're utilizing it? What does it look like for their infection control? What does it look like for their isolation practices in terms of using one wing? And so really going in and understanding what they're currently doing and how to assist them in terms of moving in the direction to really mitigate the spread in those facilities.
Yeah, wow. I really didn't realize that we were. Yeah, absolutely. Well, and another thing that's definitely gotten a lot of attention lately has been, the stay-at-home orders and the different phases of reopening. I know we're set soon for the phase 3 to expire. And, just what does all the data tell us about the impacts of the stay-at-home order and the different phases?
Well, I think when we look at the data, if you look, on our dashboard and you can pull any state's information in terms of states who implemented the stay-at-home order, and you can see the decrease in decline of COVID cases. Now, of course, everyone knew, when the stay-at-home order would be lifted, you would start to see more cases. We all know we can't stay in lockdown forever, but that's why it's so important for gradual reopening to understand what happens as you implement increased opening, whether it be at restaurants, whether it be stadiums and other sectors. What does that look like? What's the impact? What does that mean for outbreaks? But I think one of the most important things that we can see when we start to look at our tracking and our benchmarks and our dashboard is, what does that mean for mitigation measures? And so what does that mean for the basic public health practices that we have been harping upon in terms of hand washing, social distancing, and masking? And so I think we have been extremely successful here in Louisiana. As you were aware, we were a very unique state that got hit hard early on, had an initial spike. Our case growth was that of Italy, surpassed it. But we also had the same spike that most states saw after the Memorial Day weekend. And so a very unique situation here in Louisiana. We are fighting really hard to not see a third spike. We're seeing that in other areas. I mean, when you look around us in terms of Texas, Florida, Midwest, and the North, they are getting there now. We want to hold a line, and I think the mitigation efforts that we continue to talk about, that we continue to push in terms of masking, social distancing, and hand washing are going to be critical. I think we've experienced much success here. That's why we've been able to move forward with the reopenings. We've been able to, improve our economic standing, but it really has been because of Louisiana people really pushing hard on those mitigation efforts. And I really encourage people to continue that, especially as we enter upon the holiday season.
Yeah, and one of my questions, we're actually trying to plan a retreat or like a conference, for Ellevate in January. And all I hear is how everything's increasing all around the world, really. And what are our chances? Like, is it seem to be with the increases that it's weather in other parts of the country, and that we just haven't gotten a good shot of cold yet, or what seems to be the case?
Yeah, in our conversation with the White House Coronavirus Task Force, that's a big piece of it. We know in other parts of the country, the cold weather has hit and people have had to go inside. Fortunately, in Louisiana, we have not had that. And so, thankful we might always not appreciate not having a true winter, but for this situation, we have been very fortunate. We have not been forced inside. We can still have numerous outdoor activities, which has benefited us as well. And so in those areas where people are forced to go inside now, there's a lot more indoor activity that's happening that really has caused some of the increase in those numbers.
So that's what it is. It's the indoor activity rather than just the fact that the virus, because it's cold, gets more prolific.
Yeah, I think it's the push indoor that really is seeing some of the spread. There's numerous things that's contributing to it. Again, I think in Louisiana, because we did have the 2 spikes, our adherence and really push on the importance of some of those mitigation efforts is really important. When you start to look at Louisiana's testing, we have always ranked in the top 5 in terms of testing per capita. That has really helped us, the ability to identify, inform, and isolate. And so really driving the importance of testing is also, I think, has really benefited our state.
And those drive-up testing sites, more and more of that, because that's when you're not sure you have it, you don't really want to go in a place where you might put yourself at risk of getting it. And if you have somebody that has it, they don't want to go in and give it to other people.
No, absolutely. And so we, early on really created a pretty robust testing strategy that included private partners, such as some of our hospital F2HCs, also looked at working with entities such as Walgreens, CVS, and then our National Guard partners in terms of those state-operated sites, those drive-up sites, the strike teams. And that has really been beneficial because what we're able to do is we identify certain areas, certain communities, whether somebody proactively reaches out or we see the data and we reach out to our community partners there to set up a site. They have been instrumental. And so we cannot be grateful and thankful enough to our National Guard partners for being on the ground day in, day out. Those sites have been critical. They do about 1,000 tests per day at 22 to 23 sites across our state. So we have been extremely appreciative of them.
Well, and when we talk about wearing a mask, and somehow that got to be like an issue of individual difference, it was an issue that got somewhat politicized. And one of the things that struck me early on when the kids went back to school, I thought, when both of my kids go back to school, this thing's going to blow up. But they have to wear a mask all day. And the fact that this thing hasn't blown up since masks are being used at school all the time, it seems to me that masks help a lot and that masks are the key to keeping our economy open. I mean, am I reading that right?
No, absolutely. So masking is one of the tools in the toolbox. Also hand washing, you see increased intentional effort at schools, and distancing. So they're doing all 3. And we encourage people to not just do one, but it really is using all the tools in the toolbox. But you're absolutely right in terms of masking, of the importance of it. And our schools here in Louisiana have done a tremendous job from the Department of Education, Bessie, and the individual schools. Team members came out early on to work with the mitigation efforts, to do spacing, to do, student pods. And that really has made a difference. There are outbreaks in schools, but not to the numbers that they really could be. And so again, a tremendous effort by our school partners to make a difference for those individuals who they're serving. And I do think, of course, masking has made a major difference. I mean, you can look at states such as Kansas and Oklahoma who removed their mask mandate. And when you compare the counties that kept mask mandates in place and those that did not. Really, I think the last one I saw with Kansas was about a 50% difference in terms of cases for those particular counties.
Wow.
I mean, there's study after study that shows the masking and the mitigation measures work. There's study after study.
Well, and I'll tell you, I hate wearing a mask, so I work from home and I don't go out much. You know,
fair enough. I don't know most people that do like to wear the mask, but I think all of us, want to be safe for ourselves, our families, and others. And so that shared responsibility that we have for community, that's who we are in Louisiana. I think, we are resilient people, and we care about each other. And so we are so, accustomed when you look at hurricanes, and people always describe, ask me when I, was out of state, what was it like with Hurricane Katrina? And I always tell them that it was one of the hardest things that I've ever, experienced, but it was also one of the most rewarding because you really got to see people pull together. It didn't matter from what walk of life, what sector of work you were in, you did whatever needed to be done for your fellow resident. And that's what COVID is. It really is us stepping up to do what's necessary for all of us, not just each of us.
That's right, because the mask is not just for you, it's for everybody else.
You got it.
Exactly. So, okay, a vaccine, and there's a lot of talk about a vaccine, how long that's going to take. There were several companies that are close, but how will a COVID vaccine help us? And when one becomes available, and do you have any forecasts of when one could possibly come available?
No, there's still a lot of unknowns in terms of the vaccine. They're still in in the trial phase. When we look at what's really happening, it's there are going to be different vaccines for different populations, and so really understanding what we're doing on our side is planning. And so all states are in planning mode, regardless of when it's going to come. What's the preparation that needs to happen? And so there are questions in terms of, as you just asked, when will it arrive? Many folks were thinking November. It doesn't look like that's going to happen, but we're going to be prepared. We want to be prepared this month. And so most of the planning that you will see for states will be to have implementation plans for November, mid-November, end of November. We've submitted our vaccination initial draft plan, as all states did, to CDC. We've recently received some feedback, and they really are flushing out those plans for all states. There's questions around, will you need a booster? How are you going to prioritize the vaccines for vulnerable populations, healthcare workers? And so there's just so many more decisions about vaccines before we can make those decisions on the state level. But we have a vaccine action collaborative where we pull together, again, very similar to what we did with our testing action collaborative, pull together healthcare leaders across the state, not just from the government side, but public, private side, academia, different community organizations to be able to plan this process. So it's really not just a LDH effort, but it really is the full system coming together to plan what do we need to have in place in Louisiana, and how do we roll out vaccines when we have more of that information from our federal partners.
Well, I know we can't wait. We can't wait, but we also need to be careful and do all the right things, concerning rolling that out. I know.
Exactly. And even when, the vaccine comes out, so the vaccine being available is one thing, but it's also the level that the vaccine the uptake of it in terms of people receiving the vaccine. And so even when the vaccine comes out, there's a very strong possibility we're still going to need to follow those mitigation efforts because of how many people will take it on the front end. And so it really is important, going back to your conversation on masking and those other mitigation efforts, the importance of those. Again, another tool in the toolbox.
Now, I think that yesterday, I remember that I had it on my to-do list to go get a flu shot, and I didn't quite make it to do that. What's the, how much concern is there? Why is the flu concerning when it comes to COVID-19? And I know that I should have gotten my flu shot yesterday, and I promise I'll get it in the next few days.
I'm gonna hold you to that. I'm gonna hold you to it, and I'm gonna tell you to put it in social media and go ahead and put the tagline of "Roll Up Your Sleeves, Louisiana," because that's our new flu campaign. But you're right; it's important every year in terms of the flu, the availability of the vaccination. And luckily, we do have that vaccination available for flu. Yeah. But it's even more critical this year because of COVID. And what people are talking about, and you hear it constantly in terms of what is COVID going to be like in flu season, and here we are. And so the main concern, and you'll hear this on a national level referred to as the twindemic. And so that concern is what happens to our healthcare system to be able to provide care in a flu season, in a COVID environment. meaning is the flu going to overwhelm our system as it relates to the ability to provide care for COVID? So last year in Louisiana, we had about 15,000 hospitalizations as it related to flu, more than 1,600 deaths related to flu. And so part of the concern is, what can our healthcare system handle with both COVID and flu? And so since we do have the vaccination for flu, we are encouraging everyone to roll up their sleeve and get it done. The flu shot protects you. It protects everybody around you. And again, we have at our parish public health units, we have flu drive-throughs. You also can get it at your physician clinic. You also can get it at your local pharmacy. And so there's numerous opportunities to get it, on our website, ldh.la.gov/fight-the-flu. You can find out more information of where you can go. There's a vaccine finder piece on there. And so really anything that you all could do to help drive that message is going to be critical during this particular season, every season, but even more so this season.
We will do that, and I will go get my flu shot. It will be the first time in years, honestly, but I'm going to do it this year, and I am going to post it on social media and tag that for you.
All right, perfect.
Because I do think it's important. And, as we have another hurricane rattling around south of here, and we had so many hurricanes and COVID and just crazy, all kinds of crazy stuff. It's been an exhausting year, and everybody's kind of tired, and there's been a lot of impacts to everybody from all of this. But, what's been the impact of COVID on mental health, and, what are the resources available to people that might be having trouble because of all of the disasters in COVID? I know I lost my aunt early on. She was in a nursing home, and I just think that when she got shut in, it just she lost her will, and, you don't want to see that happen to people and kids that are home and might be distance learning, and they've lost their school and their ability to see their friends regularly. What resources are available, and what's the state have that can help?
And I'm so sorry to hear about your family loss. In a story that's so similar to so many this year. And so it's been a tough year, as you mentioned, because of COVID and then the numerous hurricanes that our state has faced. And so I think, one of the things we learned from the numerous hurricanes here in Louisiana, particularly Hurricane Katrina, is the long-term impacts of these type of events. And so right now we talk about, the need for behavioral health services and an immediate impact. But I think we also have to continue the conversation in terms of what are the long-term impacts and what will those be, and making sure that it doesn't fall off the radar. And we don't know them yet, but making sure that we're able to provide resources for people for some time to come. Having conversations with individuals, with our loved ones, with our coworkers, our communities, that asking them how are they doing? That it's okay to not be okay. It's okay when somebody calls and they say, how you doing? We don't have to say that we're okay, because a lot of times we're not okay. People are experiencing anxiety, grief, they're worried, and they might not know what to do or where to go. So one of the things early on that was established was the Keep Calm Hotline here at LDH. And it provides just, support and can direct people of where they might need in terms of mental health and substance abuse counseling services. But it's an outlet. It's an outlet for anyone who needs to have a conversation and that needs some additional support from some of our trained, compassionate counselors who can be there to just listen, to answer questions, and to provide the support that's needed. But you're absolutely right in terms of it has been an exhausting year. It's been an exhausting year for those who work in the healthcare sector field. It's been an exhausting year for those who worked in the emergency preparedness field. It's been an exhausting year for everyone who's been going through this, for moms, dads, for kids. You talked about, the distance learning. It's been tough for families to try to juggle work and school. It's been tough for individuals whose, employment has been temporarily shut down. It's been tough for everyone. And so really making sure that we do the neighborly thing and check on one another, I think is critical. But, we have the hotline resources available. We continue to have services in our community. We've increased, the availability of telehealth for healthcare services, including behavioral health. But it really is important that we just do general checks on one another.
Hey, can you say that hotline number one more time in case somebody who's listening just wants to grabbed a pen and is waiting?
Oh, absolutely. So the Keep Calm hotline number is 1-866-310-7977. Again, that number is 1-866-310-7977. And that's the
Yeah.
Keep Calm hotline.
And a lot of people might not realize that, now health insurance is mandated to provide more mental health services. And if you're on Medicaid, you can call your provider through Medicaid. And if you're completely uninsured, reach out to your Health and Human Services division in your local community. That's actually one of the things that you think about, uninsured and Medicaid expansion, just to shift focus a little bit. But I was in the legislature for 2 terms, one term in which there was no way Medicaid was going to get expanded, and then a term where Medicaid was expanded. And I think everybody was very concerned about, what's this going to look like for the state of Louisiana? Is it really going to cause problems? And it seems like it's helped a lot of people, and that it really hasn't cost the state budget a whole lot. So I'd just ask you, how has Medicaid expansion helped the uninsured population in Louisiana, and why is that so important during COVID?
Mm-hmm. No, so the state uninsured rate, with Medicaid expansion has been cut in half, and I think that's been really important, particularly in light of COVID, that individuals have had access to care. They've been able to receive care, not just in the midst of this crisis, but before the crisis. And so we know that individuals who are utilizing Medicaid expansion, Medicaid services, are usually a more vulnerable population. They're higher risk of becoming infected, higher risk for illness. And so the ability to have care on the front end, not just in emergency situations, is critical. Having that established source of insurance, having that established provider care is critical in terms of the safety nets that are needed in terms of the healthcare sector. We also know that the Medicaid expansion piece has helped to protect our rural hospitals, strengthening our FQHCs, and so the ability to have these statewide services intact as we look at the COVID response is critical. When we start talking about the hospitalization and the availability, the conversation we just had in terms of flu and COVID and that crossfire, what does that look like? We are one of few states that are able to say that we have not had an impact in terms of our rural hospitals. And that's amazing. And that has a lot to do with the Medicaid expansion and the availability of service and the response for that. And so I think, the expansion has provided a strong foundation for the COVID response, and an improved provider network to be able to respond.
Well, and I'll tell you, when I was still in the legislature, I guess a number of years ago, and I went on a tour of one of the Medicaid managed care providers' offices, and just the way that they were proactive about reaching out to the insureds, and the people around the state about keeping up with their health and keeping on top of things, it was really impressive. And if we're going to use dollars to do things like this, I thought it seemed like a good job was being done of keeping on people about, staying healthy, because we do have that problem in Louisiana where we might eat too much jambalaya and not make it outside enough when it's 100 degrees outside.
Well, and I think you bring a good point in terms of that care management piece of managed care that goes into it, of really being able to have that interaction with the individual that they're serving in terms of what the needs are, and giving them the choices in terms of how to make a health choice.
Yeah, exactly. One of the things that I was aware of was that we had problems with maternal mortality rates in Louisiana. And I'm just wondering about the progress that might have been made in addressing some of the maternal mortality problems in Louisiana. And, what does this issue look like in our state now?
So still much work to do, but I can definitely say, it's been some intentional effort by the department. The governor has made some intentional effort in terms of reducing the maternal morbidity. There's been a new initiative by the Perinatal Quality Collaborative around this, and we're expecting some results in early 2021. But I can tell you that some of the initiatives that have been in place, the early results of preliminary results of what we're seeing, and the focus really was around reducing hemorrhaging and hypertension as it relates to the severe maternal mortality rates. Thus far, we're able to see, and again, it's going to be released in the first quarter of 2021, but almost a 23% reduction in severe maternal mortality as it relates to hypertension, one of the leading causes, and then a 39% reduction as it relates to hemorrhaging in terms of the severe maternal mortality. And so again, still much work to do, but I think you can see the intentional effort has driven some tremendous results. As it relates to that particular initiative, they have 41 birthing facilities that signed on, and those facilities cover more than 90% of our births in our state. And so I think that intentional effort is going to be really important to continue in terms of maternal mortality and morbidity.
Yeah, because it's really important that it's such a big investment that us women make in having a baby, and to know that you're taken care of through that is so important. I guess as our time gets near to the end, I think what other big issues should we be thinking about? What are the big emerging issues out on the horizon that you see?
Yeah, so I think part of the conversation that we need to continue to have is to build off the conversations that are happening as it relates to COVID, in terms of health disparities, health equities. And that spills over to the maternal mortality conversation as well. We know that African-American women are 2 times more likely to die within the year after childbirth. Looking at the other health disparities, health equities, looking at what does it look like for our public health infrastructure. I think COVID, it really has provided some keen insight for those individuals who are not in the healthcare space in terms of if the emergency is not happening, then it may not be visible. But I think it's very clear that the importance of the public health infrastructure and some investments in terms of a national level, I do think, I'm hopeful that we will see those. The other thing I think, and it kind of tailbacks to the conversation we had in terms of mental health and the importance of making sure that we keep that on the forefront on a long-term basis, not just during the immediate situation that we're in the immediate emergency, but making sure we understand that there are going to be some potential long-term impacts as it relates to this, and that we are able to provide the services that our communities need, I think are critical things. You talked about Medicaid expansion. ACA is going to be a major conversation. And so I think those are all critical factors that we have to keep our thumb on and put some effort into.
Yeah. Well, and I usually try to wrap these up by asking, first of all, saying that Ellevate Louisiana is an advocacy organization. First and foremost, we bring women together in the hopes of elevating Louisiana and elevating women. And one of the things that I was looking at is what can we do to help in terms of advocacy? What is it that we can do to help with the Department of Health's mission?
I think, thank you for asking that and being willing. One of the things that I definitely want to do while I'm here at the department is to improve our relationships with stakeholders. And I say that because it's really important. Every stakeholder group has a group of individuals that they have close connection with, that those individuals rely upon. And so the more that we can work with those partners to push out information, share information, give visibility of what's happening in the department, not just what happens at the legislature, not just what happens in the newspaper, but really, here's what's happening in the department. Here's what we're working on. Here's how you can help. Here's how you can get involved. And it's really a two-way street in terms of understanding the voice of those individuals and the voice of the department. How do we come together to really make some improvements for our state? So we would love to have you all as a partner in terms of sharing information, being able to have our team members share on an ongoing basis to you all in terms of what are things we're working on. And then for you all to share what you're hearing from the individuals in your organization as well.
Well, we would love to do that. And I'll start by going get a flu shot and posting your information from your website on that. Well, regrettably, I'm sorry. Regrettably, that's about all the time we have for today, but I would just like to thank our guest, Dr. Courtney Phillips. It's really been a pleasure to talk to you. And in a year with so many health issues and so many emergencies and so much, it's just important to know that we have somebody strong at the helm. So we appreciate you and all the work that you and your team are doing.
Thank you. We have a great team, internal and external. But thank you for the opportunity to join you today. I do appreciate it.
Well, thank you for being here. And for those of you who are listening, if you're interested in joining Ellevate Louisiana, visit our website at ellevatela.org. That's Ellevate with 2 L's, ELLE, vate.org. la.org. You may also listen to all of Ellevate's Engage videos on our platforms where you find your podcasts. In case you're fast and on the go and don't want to have to look at a screen, you have the listen option, one that I take advantage of all the time. Finally, don't forget to like Ellevate Louisiana on all your social media platforms and share this video cast on your page if you found it interesting. I'm your host, Julie Stokes, and we'll see you next time.